How you guys doing today? I know this is a little different from my usual content, but we're doing a paper on the spread of misinformation through social media. Most of the paper is about COVID-19. During that time, there was a lot of information coming in. A lot of people were scared, didn't know what was going on. Um, didn't know who to trust, and this is what majority of the paper is about. So we can go ahead and get started. So the spread of misinformation is very concerning, especially during the time of COVID-19. We had news stations, social media, we had conflicting reports. One news station would say this, the other news station would say that. A lot of people who didn't have, any background in medicine or anything, they were giving out information about the vaccine, which they didn't really know. But at the same time, they were scared, and they didn't realize that them saying stuff, don't take the vaccine, this and that it was actually doing more harm than good. Because they were scared at the same time, so. But they were giving out misinformation, harming people. Then you got some people trying home remedies and seeing that would work, giving them information out. Other people trying it, people getting even more sick than just having COVID. But it was a scary time. Lots of people were dying. I have a quote from Samantha Reeves that says, "The beliefs in a spread of misinformation is dependent on the individual characteristics or personality and the presentation of the misinformation among all other factors." So, people who believe in certain ideologies and different things, and they're spreading misinformation, and you might not know that it's misinformation because they could have been a credible source in the past. But COVID-19 was a new thing for all of us. We're all going through different things, and we didn't have all the facts about the illness and the medicines at the time. So a lot of people believed it, but also it depends on you, because you can't believe everything you see. Do more research so you can get a better understanding of what's going on. But a lot of people were scared at the time, as I said previously. So I can understand why. I understand why they believe these different people online, and these people didn't really understand that them not doing all their research, spreading the information, did more harm than good. So at the same time, we also had the monkeypox outbreak around the same time, and there was misinformation about that on social media. But social media was used, I would say, better during monkeypox because it was more contained more quickly, and most of the information about monkeypox, it wasn't as bad as COVID. Everybody's just saying this, that. Monkeypox was a more contained scenario than COVID-19, and it didn't, spread as much, so it wasn't as feared as COVID-19 at the time. But there's other things. COVID-19, it would affect women's pregnancy, and it could. They said people were, about the vaccine. They were saying, don't take the vaccine because it could cause infertility, miscarriages, and birth defects, without, any data coming out about it. So people are spreading misinformation about that. Which you gotta think. You got the women now; they're not taking the vaccine. They're sick. Baby could get sick, because people were spreading false information and false claims about the vaccine affecting the babies, saying that it could lead to all these different things. Now the women aren't taking it; they're getting sick. I think the strain that causes on maybe their partner too. But people don't really think about that stuff. and it's hard because people are afraid at the time, so they don't really, you know, they don't really know what to believe. They're kind of in a panic state. So, but let's keep on going. Yeah. So, I mean, and during this time, I don't think a lot of people suffered any consequences. At least not from what I've found. Suffered any consequences about spreading misinformation. Like now you see the harm that is done, but it's years later, so there's not much you can really do. And most of the information just caused a panic. Then they want more help. Okay, so I have another passage I'm going to read. It says the role of mass media is to produce. My fault. The role of a mass media in this process also can be ignored. I have a quote from Sharik Shamar. It highlights that during the early stages of the pandemic, as little information was available, fake news, misinformation was spread rapidly, often led to panic and confusion. In some cases, misinformation was unverified content where was shared, furthering hindering efforts to control the virus. The rapid spread of misinformation played a significant role undermining public health efforts, showing how misinformation can both influence behavior and trust and the trust in trusted sources. So yeah, so yeah. So it also affects people trusting the news. Because if you hear misinformation, now you're seeing the news, you don't know what to believe, so you don't know if it's true or not. So when you see the news, you don't really believe what's going on. I think some of that stuff, what happened during the pandemic still affects certain people to up to the day, because some people still don't believe certain news is, you hear the term fake news. Like even our president, he used to say what Fox fake news, stuff like that. So, it's really hard for the true media sources that are actually trying to do the right thing and give good information. It's hard for them now because people don't believe them because all the stuff that happened during the past. And also as it caused stuff like a panic. Like during the pandemic, people were buying out all the toilet paper, all the paper towels, all of the food supplies, and I remember the store shelves were pretty much empty for months, and a lot of it started with the misinformation. Yeah, I think you're out there buying toilet paper, all the stuff you think you need, but you can also get sick when you're out buying all these different materials instead of saying in your home where it's you're more likely to be safe from the virus. But you got people spreading the misinformation. People are scared. They don't really know what to do besides panic. They think it's like they think I have to go do this, do that. Because you also have people online saying you should go stock up on all this stuff. Like some people saying it was the end of the road and stuff like that. Like it was a crazy time, and I'm sure a lot of people remember it. I think it's going to haunt us for at least a couple more years. But as a society moving forward, past all of this, I think people should do more research before they spread information, so this doesn't happen again. You want to prevent this in the future. I think they did better when it came to monkeypox. After COVID, so it was handled a lot better. So we didn't see as bad as people rushing to the store and stuff to get all these different materials and food and all of this. But I think we should definitely do more research ourselves to prevent the spread of misinformation. So if somebody says one thing, I think we should fact check it just to make sure, they all the points and stuff they're using is accurate. Because we don't want, COVID-19 2.0. But it was a hard time. But I think if you think we should, I think also think we should hold these people accountable for, spreading misinformation. You got your family at home, wife, kids, or husband, kids, and listening to that misinformation could harm them, not just you. So I think people should be at fault for some of the things that happen when they spread the misinformation. But that's all I have for you guys today. Just have a wonderful day. Thank you for your time.